Choking. What is choking? It is the inability to breathe caused by a blockage in the throat or windpipe. Choking occurs when an object or food becomes lodged in the throat or windpipe, blocking airflow. If airflow is blocked, choking can be a medical emergency and needs urgent attention. Choking is a common preventable cause of cardiac arrest. The correct response for a choking person depends on the degree of airway obstruction, whether the person is responsive or not, and the age of the person. Symptoms of choking: difficulty or inability to speak or cry out, inability to breathe or difficulty in breathing, labor breathing including gasping or wheezing may be present, violent and largely involuntary coughing, gurgling or vomiting noises may be present. More serious choking victims will have a limited ability to produce these symptoms since they require at least some air movement. The person may begin clutching the throat, mouth, or attempting to induce vomiting by putting fingers down the throat. The person's face may turn blue from lack of oxygen if breathing is not restored. The person may become unconscious if breathing is not restored. However, providing immediate appropriate first aid can save a choking victim from death. Choking in adults and children. In the case of mild obstruction, the person will be breathing but may also be wheezing, coughing and making noise. And in this case, the rescuer's action should be to stay with the person, to keep them calm and encourage them to cough. Call emergency response or ambulance if the person seems to be getting worse. And in the case of severe obstruction, the person will be clutching the neck, a universal sign of choking. Weak or no cough, unable to make noise or talk, may make high-pitched noise. Little or no breathing, appear cyanotic, blue around lips and fingertips. And in this case, the rescuer's action should be to use abdominal thrust to attempt to remove obstruction. Call emergency response or ambulance. Begin BLS if the person becomes unresponsive. Abdominal thrust. These steps should only be used when a person is responsive and older than 1 year of age. To properly perform the abdominal thrust, we must do the following. Stand behind the responsive person. Wrap your arms around their waist under their ribcage. Put the side of your fist above the person's navel in the middle of their belly. Do not press on the lower part of the sternum. With your other hand, hold the first fist and press forcefully into the person's abdomen and up toward their chest. Continue performing these thrusts until the obstruction is relieved or until the person becomes unresponsive. Don't give abdominal thrust to babies under 1 year old or pregnant women. Choking in infants. In the case of mild obstruction, the infant will be breathing, may also be wheezing, coughing and making noise. In this case, the rescuer's action should be to stay with the infant, try to keep them calm, do not do a blind finger sweep, call ambulance if infant does not quickly clear the obstruction. And in the case of severe obstruction, the infant will be weak or no cough, unable to make noise, may make high-pitched noise, little or no breathing, appear cyanotic, that is blue around lips and fingertips. And in this case, the rescuer's action should be to use back blows or chest thrust to attempt to remove the obstruction. Call ambulance. Begin BLS if the infant becomes unresponsive. Assess if obstruction is visible. If so, remove it. For chest compressions, we must do the following. In a choking but responsive infant less than 1 year old, back blows and chest thrusts are used instead of abdominal thrust. To provide back blows and chest thrusts, we must hold the infant in your lap and put the infant with their face down and their head lower than their chest. They should be resting on your forearm. Put your forearm on your thigh. Support the infant's head and neck with your hand and be sure to avoid putting pressure on their throat. Using the heel of your free hand, deliver 5 back blows between the infant's shoulder blade. Using both hands and arms, turn the infant's face up so they are now resting on your other arm. This arm should now be resting on your thigh. Make sure the infant's head is lower than their chest. Using the fingers of your free hand, provide up to 5 quick downward chest thrusts over the lower half of the breastbone. Perform 1 thrust every second. If the obstruction is not relieved, turn the infant face down on your other forearm and repeat the process. Continue doing these steps until the infant begins to breathe or becomes unresponsive. If the person's airway is still blocked after trying back blows and abdominal thrust, get help immediately. Call for an ambulance. Tell the operator that the person is choking. Continue with the cycles of 5 back blows or chest thrusts until help arrives. If they lose consciousness and aren't breathing, you should begin cardiopulmonary resuscitation with chest compression. Thank you.